guys, good morning if you are in United States of America and good evening if you are in global like Philippines, Asia. Salam alaikum to my friends in Saudi and Abu Dhabi. How are you guys? It's me again, Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group in Aging Adults and Physiogen PT and Wellness. I am your board certified geriatrics in age in physical therapy. And also for tonight, we always discuss and highlights our thanks God it's Thursday. For our Thursday, we have innovators, physical therapists, academicians, entrepreneurs, and PD educators. And for tonight, we have another guest, amazing. We will learn more about osteoporosis, how it happens, and different innovations nowadays and management. In my field, we have lots of compression fractures. We always see and hear falls and how to prevent, but how can we prevent these things to happen as well as a physical therapist, right? So for tonight, we have Dr. Frank Ciuba. He's based in New Jersey. He has a physical therapist practice in Pennsylvania, the HNS therapy, and also he is a tight list performance certified medical profession and is a 25 years physical therapist. Very seldom we met osteoporosis certified or credentialed specialist, and we have him today. He is a mixed method osteoporosis exercise specialist and also what is of a fourth degree black belter. Imagine we have many black belters and taekwondos and everybody, but we will learn more how it's very beneficial to have learning and also why exercise is important. Without further ado, Dr. Frank, thank you so much for this opportunity. How are you?
I'm doing good. Thanks for having me here, Jenny.
Oh, my pleasure, Dr. Frank. So tell us more about yourself, what I missed there.
Okay, well, you hit a lot of the stuff on the nail on the head. I've been in practice for a little over 25 years. There came a point in my practice where I felt that I was a jack of all trades, a master of none. And as many orthopedic specialty practices, like physicians went to specializing, I started to specialize. So the thing that has made the most dramatic impact in my practice has been our osteoporosis program, where I give credit to Sarah Meeks, who's a practitioner. She's still with us in Florida. And I trained under her and I became a Meeks method certified exercise specialist, which allowed me then to, under Sarah's guidance, learn how to teach her seminars. At that time, Jenny, it was before COVID, and we were going out and we were teaching in brick and mortar. We were teaching in hospitals and hotels. And then we pivoted when COVID happened and we went into virtual. I then had an amicable parting with Sarah as things changed in her life. She was no longer able to teach. And I partnered with Deb Galbranson, who's in Colorado right now. She's my partner, and we formed our own company called Bone Strong Seminars. But we currently also have many course offerings through Herman and Wallace, which many of your viewers probably know of Herman and Wallace as a continuing education forum. As you mentioned too, I'm also a Titleist certified medical specialist. So that allows us to treat a lot of athletes in our clinic. But our bread and butter is really our osteoporosis. With the fourth degree black belt in Taekwondo, I do incorporate some of that stuff into my exercise sessions. So it's a nice mix that we have, but osteoporosis probably accounts for about 50% of our patient population because in the community, we are known as the osteoporosis exercise specialty center. And now we actually have prescriptions that are written from physicians and to say osteoporosis center, Dr. Frank Ciuba on it. So
Wow.
we're very, very proud of that.
Yes, yes. That's good. Why do you think, Dr. Frank, why we need to talk about osteoporosis nowadays? Especially, I have a balance and fall support group. We have listeners, our clinicians, of course, and some caregivers and, aging and older adults.
Well, as people continue to live longer because of medical breakthroughs, we know statistically that 1 in 2 women over the age of probably age 55, 60, and in 1 in 4 men over the same age will suffer an osteoporosis related fracture at some point in their lifetime. So notice I said 55, 60. That's not really old. So if life expectancy is into the 80s now, we have 20 to 25 years of prevention that we need to do with our individuals. The other thing too is that osteoporosis has primarily been managed pharmacologically, and we know that the results are okay. But if somebody starts to develop a significant kyphosis in the back of their spine and they start to bend forward, the medication will not change that. The only thing that will is exercise. So we can actually take a leaning tower and bring it forward. So we are on the forefront of preventing compression fractures, preventing falls, which you're trying to do, okay, and increasing quality of life. The other thing people forget, Jenny, is that with osteoporosis, if we become very kyphotic, that also dramatically and adversely alters bowel and bladder function, digestion, breathing, and a multitude of other daily functions. Something as simple as reaching over into an overhead cabinet if I'm very kyphotic, or bent over or rounded in the spine. So our program can actually bring individuals from this to this. And when we align the pieces of the tower, the fracture rate dramatically goes down, in some studies up to 80% reduction.
Wow, that's really very important because we just need to know the basics, which everybody's forgot. So I know diet and exercise are very vital for this. So if we will ask you, Dr. Frank, just give us three simple things, maximum five basic movements that we need to include in our daily maybe routine.
Well, I'm kind of a believer like you. First of all, I think balance should be incorporated into every patient's program, every person's program that we see, regardless of their age, because we know from a system standpoint that balance is also strength. And it does so much for us. We fire our core when we do a balance. Just something as simple as single leg stance, working on wobble boards, RX pads. And then as clinicians, we know how to incorporate other body parts into a balance exercise. Number two, if people are suspected of having osteoporosis or osteopenia, which quite honestly, since it's classified as a silent disorder, that a lot of people, a lot of clinicians don't know that somebody walks into your door, they may have osteoporosis, you may not know it. They may have osteoporosis, they may not know it, all right? That you have to respect the bone. We start all of our patients on their back. We don't start them in vertical. The reason is because if you look at compressive force and loading on vertebral segments, it is the least when an individual is supine. It is the highest when what we're doing right now, you and I are sitting. So the compressive force on the vertebral bodies is the highest in sitting. So what's the worst position for our back? Sitting. What's the best? Probably lying on our back. And Sarah learned this years ago when she was looking around and people were going into gyms and they were trying to do weight-bearing exercises. We actually want to do unweight-bearing exercises initially and change the kyphosis, change the structure of the spine, and then load the spine.
Yeah, that's true because I have a cases like their posture, they're still flexible, you know. Every time they are sitting, I said do something like scapular setting, and then every time they stand, you can really see that dowager humps, you know. So I keep explaining to them the vertebral, you are at risk for vertebral fracture. And then we keep measuring. I said, you need to measure, blah, blah, blah. This is how it goes. When your posture is like this, if you can see your rib cage, they hit each other, and that's how you will be at risk of vertebral fracture. So I explained that way. And if you see that it's decreasing the space, oh, really? Yeah, so you need to be like this, you know? So
Sure.
you
Yeah.
need to explain the basics. So how do you talk to your patients? Like simple things, if you are talking to a mother or just like that is very easy for our caregivers to remember how we can adapt that.
Well, I mean, you know that in our profession, we're very good at using visual imagery. So I think if we give people visual images of what they should be doing, for instance, let's take walking, which is something simple. Let's talk about something called the high shelf concept or the shelf. So in the Meeks method, what we say is that pretend that there's a shelf that projects from your clavicles or your collarbones. If you're in a kyphotic position and the shelf is tilted down and you have an object on there, what's going to happen? It's going to fall off. Now, watch what happens, Jenny. If I try to lift the shelf higher, everything went back. Because a lot of times people think that the only thing they should do, or one of the things they should do to improve posture, is to do, say, a rowing exercise. But if you look at me and I just row, my head position didn't change. So this didn't change. Maybe my shoulder blades approximated. But if I take my shelf and I now lift the shelf higher, look where my head goes. Everything goes back. The other thing we use is the string from the ceiling. When you're
Yes.
walking, okay, a lot of us have used the string from the ceiling. It's pulling up on you. The other thing is the grapefruit carry. Pretend there's a grapefruit underneath your neck.
Okay.
Not an orange, a grapefruit. And what that's going to do is that's going to lift you up a little bit higher and increase or improve your postural, your kyphosis. So those are a few visual images that you can work on with individuals. Trying to get them to be compliant with the home program, we know, is something that is very, very important. So from a caregiver standpoint, we want the caregiver to be involved with, helping them out. A caregiver could very easily help somebody with balance. Okay. And we know that we could do something simple like perturbations. Okay. Just put them on something and move them a little bit. So those are some simple things that we can do. And there's other visual images, but probably that's what we'll get into when we do the summit in August. We'll talk, about those strategies.
Yes, yes. Thank you so much. Especially when you say Sarah Mix method. When you say Sarah Mix method, what are the principles involved with that? Because you talked about it in briefly a while ago.
Sarah was approached when she first started in the hospital by physicians who were having individuals with compression fractures and significant kyphosis. And quite honestly, we didn't know what to do with patients. So Sarah's method became trial and error. And what she learned was that taking the research, some of the old Knockington studies, that vertebral compressive forces are least when they're supine, and Sarah's background is yoga, she worked on the principles of alignment. And she started to think about, if we take blocks or bricks and they were stacked evenly, that the forces are even. But if we go like this and this and this, okay, that the tower is going to collapse. So just think about a building that's bending forward like this, okay? This building probably will not stand for a long period of time. Other things, we have to get the compressive force off the anterior aspect of the vertebral body, because that's where compression fractures happen. So when we improve alignment, we take the pressure off the anterior aspect of the vertebral body where the compression fractures happen. So her whole methodology is built on improving alignment, improving breathing, and lengthening the vertebral column. Jenny, you and I know that we have muscles that attach to the vertebrae, that if we strengthen them, they not only will bring us back like this, but we can lengthen. The average increase in height that we have for our patient is about 2 centimeters after about a month. So that's about 1 inch. So the thing is, when we actually improve alignment and we would lengthen the vertebral column, okay, they get taller. And it just so happens that if they get taller and they bring their head position back, all right, the vertebral column will have a reduced reduction or a reduced likelihood of compression fracture.
That's really interesting. Yes, yes, I believe in that proper posture. But do you think we can still be taller?
Yes, I do. And like I said, if you look at some of the you look at some of the literature as far as what we've done in the Meeks method and some of the other studies, all right, extension and elongation is really what people want to do. So many times, Jenny, people have come to us and what's the first thing they say? Oh, I used to be this height. I'm
about to
I've
tell
lost
you
this
that.
much height. Well, when we remeasure them up against the wall, we just use a simple stadiometer. And what happens is we're looking at like, okay, fine. Now you're 1.5 centimeters taller, and they go, no way. And they are, because of the way the exercises are designed.
Nice.
Then what happens, Jenny, after we have supine, then we go to prone. Prone is the second least compressive position. Then we move them to vertical. Now, once again, we don't discount balance. So we do a lot of balance with them. And as most physical therapists and clinicians do, we're always going to teach them body mechanics. We want to teach them that hip hinge bending, so that when they're up and they're bending from their hips. They're not bending from their lumbar segment, and rounding, because we know that rounding or flexion will aggravate or increase the likelihood of compression fracture. We try to minimize flexion.
Yes, that's really, really wonderful to hear. It's very new to others. And then, of course, for us clinicians, it makes sense, you know? And then for our listeners who are, oh, that's how. And I agree when you say, what's your height today? And then all my patients are post-fall and some of them had surgery. Oh, I
Sure.
used to be 5'8". Now they're opposite of after your treatment, they're taller
Yeah.
than you. But for us, they're all their height decreased because of their age and their inactivity. But
Sure.
I know this is a short interview, but definitely we learn a lot from you. What are your other books or courses that you want to share with us, Frank, other than the ceramics? I know that who are wanted to learn more about this osteoporosis and other stuff.
Well, if you go to the website of Bone Strong Seminars, where Deb and I have some of our work, we do have some stuff information there for you, and we're developing that. We're looking to add a second course, and all our courses are offered virtually. And our course is a hands-on course, Jenny. So the thing is that we actually get people moving in the virtual environment. So some of our requirements are you have to have a yoga mat or some type of a mat to lie on, okay? And Deb and I have now become very, very good of being virtual instructors. You remember the old days when you used to go to the classroom and the instructor was there and we could come up, we could correct. Now, Deb and I, we correct through the screen. So we make sure that the clinicians understand how to do it, because we have a little saying, if you can't do it, you can't teach it. I really, really think that would help a lot of the people as this population ages, to help them out. I love the Titleist approach. I think it's great if functional movement screening and Titleist are very, very intermixed. And I think the functional movement screening, if people want to look at that coursework, I think it's real good. And I've always been a big believer, because we have students, Jenny, who come through our clinic. I have a student right now. And, you talked, initially, as part of your organization is giving back to your communities, giving back to the physical therapy profession. I, as a physical therapist, have always taken students, and it is kind of what, quote unquote, pro bono. But I believe it's giving back to the profession, because if I can help a young student become a very good clinician and help to benefit the profession, I feel like I've done something good. So clinical mentoring, I think, is very important in our profession, and also being able to use your hands. So, I've taken some of the Maitland coursework too. I think that's really, really good, because as physical therapists, really this and this are probably our most important tools that we have. You talked a lot about education. It seems like you're really big on education. I think that's great. We are patient educators.
Yes, that's true. We are patient educator. We are a great educators. We have many hats in we are
Mm-hmm.
like a coach. When I told, let's go, let's go. You are an athlete today. I'm your coach. And then later on, why you don't want to do your exercise today? Now I'm a psychologist. Oh, because I'm not in
Yeah,
the
right.
and then later on, let's go, let's go. Oh, I'm like an educator, like a teacher. You're my student
Yes,
today. Oh,
sure.
you're not doing it right. So we have really different, but overall, it's education, right?
Yes, it is.
Our
It
patient
sure
is
is.
on the spot. And then they will say, oh, because Dr. Jen, you're a good teacher. Okay, okay,
Yeah.
let's do this,
You
But
did a great job.
you did a great job too. Do I have a yeah, but overall we really love what we're doing and that's coming back, and we really appreciate if our patients improve because they do their exercise, but overall that's really great things to see that another therapist is improving and innovating because of some of the things that we shared. So, Dr. Frank, really we will follow you and definitely you have great what do you call this webinars, and you said that seminars that we will need to check it out. I'm not familiar with the tight list, but I heard more on the functional movement.
Yeah,
Yeah,
functional movement
especially
screening.
more on outpatient setting. Mm-hmm.
Sure. Yeah,
Yeah.
they're very intermingled. They're
Yes.
very intermingled. Actually, the creators of Titleist and functional movement screening kind of co-teach together.
See,
So
and then
Titleist
that's
uses a lot of the functional movement screening.
And then we learned a lot more on that because this is more an outpatient setting, more on orthopedic, especially
Yes.
when you say about manual therapy. But I interviewed one orthopedic physical therapist, manual therapist. Jenny, if you have a bone, you know, because you cannot separate geriatrics, neuro, and orthopedics. As
Mm.
long you have a bone, you are an orthopedic physical therapist. You
Yeah,
just
there you go. Yeah.
we
Yeah.
just interline stroke,
Sure.
neurogeriatrics, so
Hmm.
we just specialize to give more focus on that. But definitely, you are amazing, Dr. Frank. How can we connect with you?
Well, we have our own website. It's www.hstherapy.com.
Mhm.
You can like us on Facebook. Okay. And certainly emails. And the emails are listed on the website. And you can go to our Bone Strong Seminars
Yes,
website.
yes.
You'll see my partner, Deb Galbranson. Actually, I'll be speaking with her later today. She's in Colorado. And Deb and I really, really teach very well together. We've been together now for a number of years, and we love doing the seminars. So that's how you can connect with us, Jenny.
Yes, thank you. So guys, if you have any questions, we definitely going to post some of the emails and all the website of Dr. Frank. Last message, Dr. Frank, for our listeners, for our aging and older adults and physical therapists as well.
Well, two things. First of all, we know that motion is lotion and that the human body needs to move. Okay. So we have a little shirt that says physical therapy for everybody that moves, everybody that moves. And the second thing is that we all, whether you're a patient or a physical therapist, need to continue to have goals, things to strive for. That makes us want to get better. It's very interesting. You're doing this right now. So you're going to have experienced clinicians come in and either do podcasts with you. Okay, they're going to be involved in a geriatric summit because they want to learn. They want to become better. They want to do something better. So I want to become a 5th-degree black belt in Taekwondo. Having goals keeps people moving. Having our patients have goals keeps them moving, and we have to find out what their goals are and cultivate that, and that strives them to succeed in their therapy.
Yes, I totally agree with that. You need to have a focus on what will be your goal in each
Mm-hmm.
day. So that
Mm-hmm.
makes you move. I like the PT, everybody, as in body.
Yeah. Yeah. Yeah.
Yeah. Thank you so much, Dr. Frank. I know our time is so short, but we learned a lot from this short interview. And thank you for every messages and all the updates that you gave to us, informations, definitely. So guys, if you have any questions, connect with us. And also if we will going to post all the um link regarding Dr. Frank, and you will meet him on the Geriatric Rehab Summit this coming August. So thank you so much, Dr. Frank. Thank you so much, guys. It's me again, Dr. Jenny Yusuf, physical therapist and Dr. Physical Therapy. I'm the state advocate here in Delaware, and we are neighbors. Dr. Frank
Yes,
is
we
in
are.
New
Yes, we are.
Jersey.
All
So
right.
thank you so much, guys. Bye for now.
Thank
Take
you for
care.
having me. Thank you,
You're
everyone.
welcome.